Hi, everybody. I see the numbers creeping up in the participants, so I know you're joining. Happy Thursday afternoon. This is Emily Cooper. I'm the Chief Housing Officer at the Executive Office of Elder Affairs, and I'm glad you can join us today. Today is going to be a specific, very targeted webinar for people who are in the Federal Pharmacy Participation Program, or FPPP, which means they are have the opportunity to have CVS or Walgreens come to their senior affordable housing building and do a vaccination clinic. You have been specifically invited because you have one of those properties that has been designated by the Centers for Disease Control to participate in this program. Uh, it, just to be clear, the CDC has designated which properties will participate in this FPPP. But the state didn't have anything to do with that, but we're happy to see that about 277 affordable housing properties are able to participate in this program. I'm going to just do a bit of housekeeping and logistics. We have a bunch of different presenters today. You are seeing this right now and you have been muted. You're also being recorded. If you would like to ask a question, we ask that you use the Q&A button below. The chat has been disabled, so you won't be able to use that function. So use the Q&A function and we will be monitoring that. We will be asking the presenters questions. We have presenters actually from CVS today who are going to talk about how the process works and how to highlight different areas. If you have questions about other properties that you operate and how to get vaccine clinics to them, those questions will not be answered today. And we're going to put in the chat to you right now, senior housing vaccine at mass.gov, where you can send those questions. We will also put the website for the whole senior housing vaccination effort for the state in the chat, and you can consult that website later. I am just going to share my screen for a second while I continue to talk. Lori, I'm going to steal this from you. Sorry, I didn't warn you about this. I hope it's okay. And I would just like to put on the screen, and while I talk, hopefully you can all see this. This is a list of the properties, the HUD properties that are in the FPPP program. I'm going to scroll through it slowly. You should be on this list. These are the folks who are eligible for the program. These are the folks that we're going to be talking to today about these specific properties. If you have any questions about if your property is listed here, and I'm going too fast, put it in the Q&A. We just don't want you to be, it's sort of like when you get on the airplane and they say, are you going to the right place? We want to just make sure that you're in the right place today for this call. You'll also see that some of the names may not be exactly what your housing still goes by. These names are what HUD has in their system for your property. Most of these properties, in fact, all the ones on the call today that we're talking to, were funded through the HUD Section 202 Supportive Housing for the Elderly program, and as such are therefore eligible for a clinic on site. So I'm going to go scroll slowly while we talk about this. As I mentioned, the Federal Pharmacy Participation Program is one that is launched by the federal government, by the CDC. It actually started back in December with nursing homes, assisted livings, and continuing care, retirement communities, and rest homes. And we were pleasantly surprised to see that when we got the list, it included a bunch of housing properties as well. And so clinics began on January 11th with housing properties. We've done, about half of the HUD 202s in the state, and we're about to start the next HUD 202s, which is you all. The list that I am looking at right now is actually posted online, so you can see all the different properties that have been involved in the program. So I think I'm almost at the bottom of this list. I've gone slowly. I've tried to talk slowly, which is hard for me to do. Many of these folks have already had their clinics, and many of them are having their second clinics now as we speak. So I'm going to stop sharing. Lori, I'm going to send it back to you to share the screen. If you can put up the PowerPoint, that would be great. Thank you. Can you go to the next slide? And the next slide. So as I mentioned, this is all about the FPPP program. If you have questions about your other properties, please note that those are not being covered today. This is a very specific webinar. Next slide, please. So through the FPPP program, these Section 202 HUD properties should have already received initial outreach mail from CVS or Walgreens. You also should have heard from MassHousing or CEDAC to just say, how is this going? Checking in, telling you about this event. If you are on this webinar and you have not received anything from anybody, please let us know. You should be hearing from CVS or Walgreens if you haven't in the coming weeks to schedule 2 clinics, which will be 21 days apart. You'll hear more about that from CVS in just a minute. These clinics, just so you know, could happen at any day of the week. They're not a Monday through Friday thing. And I want to tell you that rescheduling is extremely difficult. So we really encourage you not to reschedule and to work from the dates that you're originally given. The clinic logistics, the arrangements, the space configuration, the scheduling, all of those things are the responsibility of the housing provider. CVS shows up, they put vaccines into arms, and they observe people for 15 minutes afterwards. That's what they are responsible for. Everything else, getting people's paperwork completed, figuring out how people are going to flow through the space in a way to keep them socially distanced, that is on you all to figure out. If you need help with that, you should be reaching out to us and we will try and help with volunteers and other things. And we'll spend some time talking about things that you can do now. Think through the type of volunteers that you might need. Is it somebody who's going to photocopy paperwork? Is it somebody who's going to usher people? Is it translators for different languages? If you have a space that does not accommodate a clinic in a congregate kind of way, like a lobby or something like that, there is the option to go room to room, but that is only if you are not able to accommodate a clinic. So it is not something that is allowed unless you're not able to accommodate a clinic. So just or if you have somebody who is homebound and can't come downstairs. So know that. If for some reason that room to room is the only option, you need to tell CVS and you need to let us know at the Senior Housing Vaccine at mass.gov site as well. The paperwork, there is paperwork. It should be, I'd be working on it now. It's a lot of paperwork, especially in the beginning. You're going to have to get, consent forms signed, insurance forms copied. Start doing it now. Start thinking about who you're going to put. You have to fill out a roster for people of who will be vaccinated, and you should also be including staff on there as well as any volunteers that are going to serve at the clinic. Next slide, please. So what else can you be doing now? First of all, we want to make sure to get as many people vaccinated as possible. So start talking about the vaccine. On the website that we've provided in the chat are lots of information about safety, myth busters. CVS also has stuff on their website, as did the CDC, around why it's not scary, why is this something that they might want to do. Talk about the consent forms, start explaining that to them. Reach out for help if you think that you need somebody to help address any hesitancy that's going on among your residents. We've also heard that some residents plan to get vaccinated at the PCP's office, again, or they are going to go someplace else, which is totally fine. But you should also know that they don't have to, because this clinic will come to them. So it's if they're not comfortable leaving the site, we will be bringing the clinic to them. So I am done talking, there's a few people who have said they have not heard from CVS yet, and we will check on who. I think some of this is also about who's listed as the contact person. So we'll get back to you, but I'm going to turn this over to Dylan Ripka from CVS. And Dylan, maybe you could give everybody your title and tell them who you are, and then take it away.
Yeah, thanks so much, Emily. And hey, it's a pleasure to be here with all of you today. So my name is Dylan Ribka. I'm coming to you live from the Boston area. And my official title was region director prior to this project. And like many of us, our lives were uprooted and turned around when COVID struck. And we've been tasked with this, what I'm calling miracle work, right? Which is immunizing our state's population and those that need it most in the best way we know how. So my title now is the lead for that COVID operational effort for all of the Northeast. And the great state of Massachusetts, where I live, is one of the states that I cover. I'm also, just to share some stats, it's pretty incredible when you think about when we started this project in our long-term care facilities, assisted living facilities in the state. We really didn't know what we were doing, and not just CVS. I mean, any of us, right? And we came together as a team, and it hasn't been perfect. I'll be the first to admit it. It hasn't been without challenge, but I think nothing incredible is, and I think that it's pretty incredible that we've immunized over 150,000 people in Massachusetts already through this program. It doesn't seem possible, but we did it, and we're going to continue to do it with each of you on this call. So my goal today is to just talk about some of what we've seen, outline the process a little bit for you all, and answer any questions you might have to make this process a little easier now that we've got some reps under our belt and we kind of know what we're doing. So there's some slides I shared, and I'll kind of talk through these anecdotally. But I guess I'll start with the timeline, which I know you all are very curious about. So we mentioned there's a couple points of contact and things that need to be done prior to the clinic occurring. And we're now in the very early stages. The nice thing about this is we have some advance notice so we can prepare and make sure we're all aligned on what we each need to do. So I will tell you, before I even get into this slide, the timeline that I'm working with my clinic teams and when you can expect to know your date, right? So what's happening behind the scenes is we've got the list that was just shared. So if you're on this call, you are on the list. We have your information, and we're working to get you a scheduled date by managing our teams to make sure we can match you with a day and time. So my plan is to have that completed, mapped out schedule completed on my end and sent into the state by next Friday, the 19th. And your clinic dates, the dates in which we will be doing your first clinic visit, we're speculating will be between 2/28 and 2/13. I'm sorry, and 3/13. So the first 2 weeks of March is really what we're aiming to complete all of these first visits by. And then obviously 3 weeks thereafter, you'll have your second visit. So you can expect to know the date, if everything goes according to plan, which it should, by next Friday. And then your clinics will be starting the Friday thereafter, 2/28. So that's the timeline that I have in sight. Now, what is happening as we lead up to that? So I mentioned I'm making the schedules, right? So once we establish your date, this timeline you're looking at on the screen, which may be a little small, but that's okay, is when that kind of kickstarts. So that is when you will receive an official automated email, if you haven't received one already, stating your specific date, time of the clinic, what have you. There's an important point I want to make on time, but I'll wait till the end for that. So that's a week out, right? So you'll have advance notice of your time, but I'm going to give it to you even before then because I'm hoping to have that schedule solidified. You will get a delivery of packets shortly thereafter, and some of you may have gotten this already, but this is really important because it contains those consent forms. And one of the learnings we've had as we've gone is that having those consent forms filled out by everyone that's slated to get their vaccine and a photocopy of their insurance card kind of stapled to that consent form is the single most important thing to prepare. Because as you can imagine, if there are 200, 300 individuals getting shots, that process becomes extremely complex and out of whack if we don't have consent forms matched to the patient, assembly line, you can follow along there. So having that pre-work, I'll call it, done is really important. And that's why we're trying to get you those as soon as we possibly can. After you receive those, you will be confirming the clinic date. So there's 3 confirmation methods you can use. We'll get to those in a bit. I will just say that, I guess I'll just be candid that there's not much flexibility in the date. So our hope is that when we give you the date, you kind of make it work, right? Because unfortunately, there's a lot of logistics that go on behind the scenes. And there's just, as I believe Emily said, little flexibility in those dates. So we just need a confirmation that you're aware of that date and that, someone will be on site and we can proceed. As we get closer to the day of the clinic, there will be another email you receive asking you to upload it's called a multi-patient upload. And we have some resources that tell you how to do this, but basically it uploads all that patient information that's listed on those consent forms into our electronic system so that when we show up, all we have to do is hit a key. The patient profile is loaded automatically with all their information. The consent form then just serves as our safety check to make sure we've got the right person, and we ask all our screening questions and make sure they're safe to get the vaccine, and then we can administer the vaccine. When this process is followed, meaning consent forms and the digital multi-patient upload is completed, we can give someone their vaccine start to finish in a matter of 4 minutes. So without that, it adds some complexity and time, and that's what we're trying to avoid together. So those two are the really most important elements in this timeline. I won't go through the rest, but I'll talk a little bit about the day of the clinic as we go forward. So if you want to move the deck along here, you can feel free to share this with everyone on the call, and this is available publicly on our OmniCare website. So it has all the resources and explains everything that I just kind of went through in more detail. So you can go ahead and go forward. Yeah, shows how you do the multi-patient upload. And then I think there's one more page. Yeah, so we can pause here for a moment. So that's kind of all the leading up to the clinic, right? So consent forms are completed. You've got those in the insurance forms together. We've got that multi-patient upload completed. And another point that comes up at this time, which I failed to mention, was just getting in touch with us. So I'll be honest, there's been some issues with communication on both of our sides, right? And I'll just talk about why that is. Number one, on the CVS end is we have a series of representatives that are calling and outreaching in the days leading to the clinic to answer any questions you may have, confirm that date that we're coming, outline the experience, confirm the number of patients, what have you. And these are, think of this as like a call center, right? So it's, sometimes it's an OmniCare representative, sometimes it's a call center. And just due to the sheer volume of clinics, that's the way it is. 5 days in advance of your clinic, you'll be receiving a phone call from an individual like myself who is actually in charge of the team coming. Think of this as your local guy on the ground that you can reach out to in that 5-day period leading up with any questions or concerns. And that's a really important phone call because with that individual, you'll be discussing how the clinic's going to work, right? What we can expect to show up, where we should be parking, all of those last minute logistic things. And a really important one for these clinics we're doing is the layout of the space. So if I'm guessing or looking at the data, it looked like the average number of participants in these clinics was somewhere around 200 shots. And the challenge is that, with our operating model, it's really designed as shown here, where, we have a large area that requires or allows for patients to queue themselves in line while being socially distant, showing up for their appointments, consent forms in hand. They would approach our table. We would data enter through a laptop the information needed, make sure everything's squared away and safe. And then they proceed to the immunization area where we have 1, 2, or 3 immunizing pharmacists or nurses to deliver the vaccine. From that point, it's a mandatory 15-minute waiting period that we have to observe and make sure there's no reactions, as this is a new vaccine for all of us. Now, if you don't have a space provided for that workflow, this becomes a very different challenge in itself, because that would mean that we would have to go room to 200 rooms. And the reality is that we often don't have teams that large to get that kind of clinic completed in a day. So it presents a lot of logistic concerns. So the real ask and really requirement for these would be, number one, that you have a large space that could facilitate that workflow, which is people queuing in socially distant, a registration area and table, an immunization space, and then a waiting space with some chairs so we can observe and make sure that everyone's safe. The second requirement, and that you'll go over on this phone call with the representative 5 days in advance, is that someone is on site that is, I'll say, in charge, right? Like there has to be someone at your facility that is a representative of that facility. We've had some instances where we've shown up and there hasn't been that, and it's very difficult because with our labor model, we don't really have someone to queue those patients in and make sure that they're filing in single order, socially distant fashion, directing people where to go next. We have, just the operators of the clinic. And I think Emily alluded to that earlier, but it's really important that someone is available on site to address any of those issues or help with some of that process. So those are like the really two requirements that we would have. And you'd want to go over that with this individual that's the boots on the ground guy that calls you 5 days in advance to talk through all of this. I'll say if there's any reason, like Emily said, that we can't have a open space to gather, we would definitely need to know about that as early as possible. And I would honestly say, even before the 19th, when we have the schedules finalized, because we would have to make different arrangements with teams, timelines, et cetera, to get that done. So I guess my ask would be if you don't have a common area or space, if we could find a way to have that information sent to CVS, that would help us out a lot in our planning. And I don't know if we can talk about that at the end or what have you. The other thing I'll add, and I know I'm kind of throwing a lot at you here, but the other thing I'll add is bed counts in general. So I mentioned that on our side of things, we plan for a number of patients to give vaccines to. And what we've found are there's a lot of discrepancies in those numbers. So you understand that, we not only plan from a staffing model for X number that we're provided, but we also plan from a supply allotment standpoint of how much vaccine we need to bring and what we need to ask for from the federal government. So if those numbers mismatch, it causes a lot of issues. So we really want to make sure we're clear on those numbers of individuals. And I also just want to reinforce the importance of sticking within the state guidelines. We're certainly there to immunize the residents of your facility and any staff members that work on site and are thus in that phase 1B criteria. Obviously, if that's a volunteer and they work weekly in the facility, of course, we need to give them their vaccine. We would just ask that someone from the facility, again, another reason they have to be there, day of is, unfortunately, we've had some instances where family members or individuals outside of that population are being added or sneaking in. And that really puts us all in a tough position and one that could compromise our whole operation here, right? So I know we all want the vaccine, but we need to make sure it's given to the people that need it most. So that would be the only other ask I would have or item to bring up with this group. So I said a lot, and that's a really high level overview of this process, timeline, and what the day of could look like. So Emily, I don't know if you want to allow for any questions at this time or anything else you'd want me to cover.
Yeah, no, I think this is really helpful. Thank you. I have actually been dealing with questions. Most of the questions I think are about angst around contact information. So, the contact information we originally gave you was what was given to us by HUD. And we're hearing that many of those people, don't work at that agency anymore, aren't the right person to be, et cetera. So we have been telling them to go to your website and update that information through your, contact little form there. But those folks have still not heard from you. So I know that we had on the 25th, or maybe it was the 28th, there was original email sent out to everybody. But since then, we have learned that some contacts were not correct. So they haven't, I think people are worried because they haven't heard from you. They see that they're on the list, but they haven't heard anything from CVS because the original contact was wrong. And since then they have corrected their contact through your website. Is there a time when they will be hearing from you? I think people are quite nervous that you have the wrong contact information and you're going to miss them somehow.
Yeah, and I'm glad you brought that up. that's a real concern. I'm not sure who's driving this PowerPoint, or if you want to scroll up just a page or two. I think it's on page 3 of this document. One more. Right here. So you can see this clinic confirmation. There's this bolded phone number here, 866-211-5678. That's the number it's one of the ways you can confirm your date once your clinic is assigned. But I would recommend, if you know your contact information is not accurate at this time, we can try to have you call that number and see if that individual can assist with updating your contact info. It's feeding the same document that we're working off of. And forgive me if I'm not as clear as I should be here, because that's not really my area of expertise. And Emily, I can even work with you if there's a better way to update.
Yeah, and so we've been feeding those updates to you as well. I don't want to put you on the spot. There has been some confusion, because I think some people have emailed the scheduling folks and been told they weren't in the program. So there's some confusion whether these are loaded into your system or not loaded into your system. So I think in general, there's angst about, am I in, am I out? I haven't heard, things like that. So if what I'm hearing from you is that you want to do clinics like the 28th of February, and my understanding is you reach out 2 weeks ahead of time, right? So that sorry?
7 days ahead of time is when the official timeline starts.
Oh, so you wouldn't be, the scheduling people wouldn't reach out 2 weeks ahead of time. They only reach out over 7 days. Okay.
So
I guess the promise I will make to the people on the phone is that, we will continue to tell CVS from our end, and you should call that 1-866 number. Hopefully you are in the system and can update your contact information and, cover all your bases, because there is the online form that people have been updating their contacts as well, where it says,
I should share this too. I should have been more clear with this. So the one thing we're doing differently this go around, I'll call it, from our learnings, is the reason I'm giving those timelines of, I'm being conservative, saying I want our schedule complete by 2/19 to present to Secretary Chen and everyone we've been talking to, is because I intend to have her then share that with you all. And if something mismatches on that, we'll call it master file, we can easily be alerted of that at that moment, because you'll have the bird's eye view of what's coming, right? In clinics past, I'm not sure you've had access to that schedule, that complete list. And there's a lot of reasons why. A lot of it has to do with a reporting system called Tiberius and the state government. But that's something we're doing to prevent exactly what you're talking about. So I know you're still antsy and thinking, time's ticking here, Dylan. But I'm really hopeful that solves that issue, because you'll have that sheet and say, hey, Bill doesn't work here anymore. It's Emily. I'm going to update this. I can call an update. So I'll even work, Emily, maybe now that I think through it, if I give you a direct, specific way to report that information. Hey, here's the schedule. And
Perfect.
This is how you update the contact. Does that sound good?
Yep. That would be great. And we will, for the folks on the phone, you've been hearing from CEDAC, you've been hearing from MassHousing. They have been getting your updated contact information. If you still haven't heard, you should be making sure that you're sending it to senior housing vaccine at mass.gov, because we have a relationship. I talk to Dylan and Stephen at CVS twice a week. And I will make sure that if they say to me, I haven't heard from these people, then I can get them that information. Dylan, you have some questions related to sort of the clinics. So Sharon asks, given that they can give the vaccine pretty quickly, should there be more stations for people to be observed post-vaccination versus vaccination stations?
Absolutely, yeah. So I'll share what some of the local ones we've done look like, right? So let's say there's 200 individuals. We'd probably have 2 or 3 immunization stations going at once, coupled with 1 registration table. So you can imagine a socially distant line forming of individuals coming in, approaching the table, which is very quick and easy with the consent form filled out in hand. And then they're deferred to one of the pharmacists or nurses for their actual vaccine. But in that scenario, I think 15 or 20 chairs, if you will, to sit and wait for the 15 minutes sounds reasonable, because we can keep that system flowing so long as it's not getting clogged with that kind of limiting step, if you follow me there.
But to be clear, they need to be in sight line of the vaccinator, because CVS is responsible for the observation, nobody else. It's their liable. So they need to be able to see people. Although you could have somebody there who's got a timer telling them that their 15 minutes are up, they're not responsible for saying, hey, this person, we're going to look at their symptoms.
Correct. So I'm imagining a rec hall or a cafeteria where, you can have chairs lined along the wall, which are waiting socially distant, right? Which are easily in a visible distance from the immunizer and the registration table.
Okay. And what vaccines are you using?
So we've been granted exclusively the Pfizer vaccine for this entire operation.
Okay, great. And what about residents who can't find their health insurance card? I know you don't need health insurance to get this. So what do you do with that situation?
Well, as long as they have their consent form filled out, and some of the information on that consent form are items like a social security number. So I would just stress that becomes very important if we can't find their insurance card, because most seniors would have a version of Medicare in which we can look up using something like a social security number for them. So we can.
But some of the folks are going to be under 65 who are being vaccinated, so they won't have Medicare. So, or they might have lost their card. But so.
Well, I'll say it this way: we never refuse a vaccine.
Okay, I think we got down to somebody said they needed to have at least something that said their name or date of birth or address on it. Yeah.
So the way that that would be bucketed for all intents and purposes as an uninsured. If we can't locate coverage, and there is a way we can get them the vaccine through the federal government that way. But we do require that driver's license number and some unique identifiers.
Okay. When you schedule the first clinic, do you also schedule the second clinic?
Yeah. So you can even map it out as soon as you get your first date. The next clinic is exactly 21 days after your first clinic.
Okay. What about people who, they give you they give you a roster of who they think will be vaccinated, but between the time they gave you a roster and you show up, some people went and got vaccinated on their own already. How does that play out?
That's okay. Less is okay, because the way we transport the vaccine is it's still good. It's refrigerated, controlled, temperatured, what have you. So if you would say it's 200 doses and it ends up being 163, we simply just move that product back to our store and it's still viable for the next clinic. So there's no loss. The risk is, if we say 200 and we show up and now it's 240, we wouldn't have the vaccine for that, and we wouldn't have the staff really for that either. So that's the risk.
Okay. Is it a good idea to have a standby list so that no dose goes unused, or?
So that's something we learned as we went, right? And I'll share that with a Pfizer vaccine, which we're using, each vial contains in between 5 and 6 doses. I know it's funny I say it that way, but if you've been following the news, you know that. And so we only use one at a time. So at any clinic, the maximum amount of, we'll call it leftover, that we would stand to have would be 4 or 5 doses. So we always usually, when we enter the clinic, say, hey, if we can't map this out exactly right, we may have in between 0 or 1 and 4 extra doses when we end that we can't, it has to be given and we can't transport it since the vial has been disrupted. So in that instance, are there 3 people that you can think of that would be next up that you'd want that dose delivered to while we're on site? So that's kind of how we've been handling that. I know it's kind of gray area, but I wouldn't plan for that. I would say it's a nice to do if it ends that way.
Okay. Thank you, Dylan. Don't go anywhere. I'm sure there'll be other questions for you. But I think we want to turn it over to some folks who have had their clinics already. So I'm going to turn it over to Kate Swope for a few minutes, and she can share. Yep, there you are, Kate. And she can share how things have gone. I think, Lori, in the slides, we have put some tips. Kate, tell me again, you've done 71 of these CVS clinics?
76, including one today.
76.
Right
now, she hasn't been at all 76, but she has overseen and coordinated and organized 76. So, we thought she'd be a good person to talk about this. So go ahead, Kate, take it away.
Thank you, Emily. So if we can pull up the slide, I think there's a couple slide pieces for my presentation. I spoke a week or so ago, and we talked with a number of you about steps to keep in mind for day of clinic. Just checking on the slides. Okay, great. The first thing I would say to take a step back, we are, as Dylan and others have mentioned, we are all learning, at this process together. So my strong recommendation is over plan, have more staff than you need for day of. And that I think can ensure both a smooth execution, and it can also help with anxiety levels, because keep in mind, this isn't just a holiday party we're hosting for residents. We've been told to gather 150 residents and have them come through our community room when we have likely many properties have been keeping those community rooms closed for many months at this point. So anxiety levels, I think both for residents and staff can be quite high. And also it's quite exciting. So, my strong recommendation is, again, prepare, determine how many staff you will need for day of clinic, language capacity needs that you'll have on site. I would encourage extra staffing for door of vaccinations and observation area. We have been doing about 5, at least a minimum of 5 staff on site. We have been providing mobile hotspots. CVS does need to have access to Wi-Fi. They have at least one individual that does registration. And so having that Wi-Fi login and password on a piece of paper that you can give to them right away will help them get going. We have been offering HEPA air purifiers as needed at sites that have poor air flow, and also really encouraging everyone to open windows and doors. Let's just get some airflow moving within the space. Volunteers can be accessed either from your other sites, or local ASAPs have been incredibly generous reaching out to offer assistance as well, whether it's on site or prepping beforehand. Make sure you've got all your supplies. This may seem very detailed, and fussy, but I mean, again, we want to make sure that staff felt comfortable. So we've been offering PPE in the form of masks, gloves, face shields, and gowns. Staff can elect whatever level of comfort they feel like they need. Of course, masks are required for all staff and all residents going through the clinic at all times. Pens, everyone gets their own pen, no sharing. Sanitation supplies at entry and exit. We've been using sticky notes for the 15-minute timer, and so someone receives their dose, you give them a sticky note with the time that they are done, and then we also have someone on an administrative capacity monitoring that observation area. That observation area is your bottleneck, right? If you can fit 10 seats or 15 seats, however you can do with 6 feet social distance, that really determines how many residents you can have come in and how fast you can go. Depending on the size of your site, you really want to be mindful of how many residents you have queued up in the hallway, waiting to come in. What we have been doing at most of our sites, especially larger sites, we have our call list. We start calling residents down. We try to make sure we have no more than 5 to 7 residents waiting in line in the hallways, because it does take up quite a bit of space. And for senior residents to have to wait a long time is challenging. However, you need to have at least one staff member that's calling people on a continuous basis. You get 1 or 2 in, you call, you make sure you have a few more coming down. That's going to greatly increase the efficiency of the clinic. For day of, CVS staff members have been arriving approximately 45 to 60 minutes earlier for setup time. When they get on site, very important to confirm the number of doses that they did bring. Again, as Dylan mentioned, we've learned, 5 to 6 doses in that vial. So, your standby list, that's one question. We have been hearing that CVS will bring approximately 10% extra of doses in case there is breakage. And so sometimes the clinicians do turn to us and say, well, we've either got 4 to 5 or 12 if you've got additional residents that you would identify. We have had pretty strict registration deadlines for residents and on-site staff to complete. If a resident misses that deadline, we've been putting them on our standby list. So those couple extra doses, we let them know we can't guarantee, but if day of, if there are extras, we can get them in. So I think that really ensures that nothing is wasted. If we can do the next slide, please. So room setup, and Dylan talked about this. There's also great resources on CVS's website that map all of this out. But clinic space, you're looking for at least a 10 by 10 space. Everything has to be 6 feet apart, tables and chairs, etc. I'd recommend trash barrels at all areas, hand sanitizers, separate door for entrance and exit when possible. Registration table with chairs, near outlets with extension cords, administrative table, and observation area. My understanding is that it is a mandatory 15-minute observation for anyone. It can be up to 30 minutes if someone has a history of allergies. So there may be the rare case where you do need to do a 30-minute observation. Of course, CVS will let you know that. We have made it very clear no food or drink allowed in the clinic area. That's been really important as well. And again, recommending at least 5 to 6 staff on site. You've got your person at the front door managing crowd control, registration, observation area, someone assisting residents to exit, and then a runner to knock on doors is needed to remind residents to come down. We also have done a handful of in-unit vaccinations for residents that are too frail, they're unable to come downstairs. What I would highly recommend is make sure that you identify these individuals, have them set up for towards the end of the clinic, because you will need to have a staff member accompany the CVS representative to their unit door for the vaccination, and then they'll need to be observed for at least 15 minutes. So you'll need extra staff if you have 3 on one floor. If everyone can put a chair outside of their unit door to sit on it, you may be able to have 1 staff member observe the 15-minute for all 3. So that is very quick. Actually, one thing that I did want to mention, and maybe Dylan, a question for you. So there's both the forms that are mailed, the consent forms that are sent to the site, which is a triplicate carbon copy, old school form. And then on the website, there are a number of consent forms that can be downloaded in different languages. My understanding is the consent forms that are being sent to the sites are just in English. Is that correct?
Correct. The triplicate forms being mailed. Yep.
Okay. So one thing that we've been doing, and Dylan, again, jump in if this is incorrect or if you'd like something different, is we have been deferring to the PDFs that can be downloaded on the website for 2 reasons. One, they're in many different languages. I'll actually do a screen share and show you what that website looks like. All right. So when you go to CVS's OmniCare website, there's a tremendous amount of resource here. Let's just jump actually to the consent forms. So if you see, you've got Spanish, Chinese, and two variations, Portuguese, Russian, Vietnamese, etc. There's a lot of languages here. So I would strongly encourage you to go here to print blank copies and provide them in all the appropriate copies for your site ahead of time. And now you need to have these forms in triplicate. We have some cases where we have made 3 copies and provided them to CVS. They just want 1 copy to write on, and then they want you to make copies of it afterwards. And sometimes they will fill out both copies as they sit down with the resident. So that's just something to talk through with the CVS rep when they show up.
Hey, can I interrupt you?
Yeah, please.
You've been asked, can you put the forms on both sides of the same sheet? I'm assuming no, because you use it's in triplicate because you're giving them to different people.
Correct.
Right?
One for the facility, one for CVS, and one for the patient.
Okay.
Yeah. And, as you look at the consent form, which I think some have seen at this point, information to fill at the top. Is it dose 1 or 2? And then on the bottom of the second page is information filled out by the vaccinator at the time of clinic. So you're gonna need this every single time. This will be filled out there. My guess is the idea of the triplicate carbon copy form is that you can fill that out once and then everyone gets a copy. One for CVS, one for the facility, one for the resident. What we've seen, we were trying to make 2 and 3 copies to have them all available. And sometimes CVS will just write on one of them and then we need to make extra copies. You know, as Dylan mentioned, having all your paperwork in order ahead of time is critical. So I would say err on the side of caution, have 3 copies of everything for day of. So a couple other things on CVS's OmniCare website. I would really encourage everyone to begin with the clinic guide. Dylan shared this earlier. This is just a couple pages and gives you an overview of what to expect for day of. So this will be critically important, I think, as a great place to start. Also, the multi-patient registration template is an Excel document. So once you have a list of everyone for the site who will be receiving doses, this Excel document needs to be filled out, 1 per facility, and then uploaded through CVS's OmniCare website. And there are also instructions on how to do this. This is quite a time-consuming process, so I'd recommend getting that paperwork in early. You want to make sure there are no errors on the form, otherwise it will be kicked back from the CVS upload. So this is a really critical part of the process.
And Kate, do you need to have some sort of OmniCare account to upload it or to do anything?
Yes, you need to have a registration to be able to log in to upload. Yeah.
And that registration comes from the CVS contact to you?
That is initially when you register for your site. Yeah.
Right. So then, and then the initial outreach from CVS that these folks haven't had yet will include how to set up an account on OmniCare. Okay.
Yeah. Yeah. And you also see that on this OmniCare website has quite a bit of resources. So you'll see that information there as well. There are webinars. The multi-patient registration and billing guide is the how to upload with step-by-step. It is quite detailed, and I do think once you have that Excel form completed, you then begin here and it will show you exactly how to do that whole upload. There's also a few other resources, understanding and addressing vaccine hesitancy, and posters as well. We have elected, because we didn't have it readily available when we started, we've been using 2-page forms from CDC around just what is the COVID vaccine. I know the state of Massachusetts also has some great FAQs as well, and they're available in multiple languages. So what we've been doing is a flyer for every resident about here's the clinic date and time, the 2-page consent form in their native language, and then a 2-page FAQ on vaccines, either from the CDC or from the state of Massachusetts DPH in their native language, just so that they have that information ahead of time.
Kate, I am going to ask you one last question, and then I'm going to ask that we move to the next speaker, if that's okay, just because of time.
Yeah.
So the one last question is, you mentioned Wi-Fi, or do they show up with their own hotspots?
That has ranged quite a bit. Some CVS teams will come with a hotspot, many do not. The original ask in the guide was to make sure that Wi-Fi is available.
Okay,
and
so that's something that if there's no Wi-Fi, they have to figure out getting a hotspot.
Yeah,
no Wi-Fi in the building.
And we do have the hotspots. I would just say, let's be clear with that, and that boots on the ground, 5-day out, right? Just indicate that to your representative that calls you.
So they could bring them if they know ahead of time that there's no Wi-Fi, they can bring a hotspot.
Correct.
Okay, right.
And one more point of clarity, I hate to cut you off, but I do have to drop it exactly I'm sorry, I apologize. The consent form is one point that we also just want to clarify. I know it's early, but we require them for the second trip as well. So you would need the same consent form process filled out for your second clinic, just as you would the first.
So they might as well do them all now, right? And it's just one wet signature and 5 copies, right? They're going to need 6 filled out, and I think it's, and only one, they can get one signature and make 5 copies and get them all set for both clinics.
Yeah, what they could do is
copy
the demographic information from the one, and then you could just hand that to the patient. That would also serve as your check to say, hey, I got my first dose, you need your second, right? So that might be a best practice.
Okay. I'm going to turn it over to Marianne Delory right now from Colony Retirement Homes, who, although she has not done as many as Kate, and nobody, I think, wants to be Kate at this point, and having done that many, she does have some tips for us as well. So Marianne, take it away.
Hi, everybody. So I've done about 7 clinics. Some of our clinics were at the same time, so I haven't been at every single one. But I do have a couple of quick pointers for you that should make life go a little bit easier the day of clinic. I do have an outline. If anybody would like to see it, I'd be happy to share it after this session. Just drop me your email and I'll be happy to send on any materials that would be helpful. So the first and most important thing you need to do is to actually promote the clinic. Post educational materials around your community about the vaccine, about what they can expect. If people, despite them being afraid of COVID, they don't want more fear in their life. So anything that you can do to assuage their concerns, including providing them with materials that they can read, is going to go a long way. Also, in your advertising, tell them to wear short sleeve shirts and bring their glasses. The short sleeve shirts are so that they don't have to disrobe in the middle of the clinic to get to their arm. And the glasses, because we have an elderly population and everybody who comes down and they have to fill out some questions the day of the clinic, you know, including, are you well today? They don't have their glasses on. That means we have to stop and take the time to read the questions to them. If you don't have adequate staffing for that, that gets to be problematic. So advise them to wear short sleeve shirts and bring their glasses. I also would encourage anybody to offer incentives if possible. Honestly, the incentive we offered was peppermint patties, and you know, at what, 70 cents each, it was well worth it. People were absolutely thrilled to get a candy bar. They came the second time around looking for a candy bar, and we were like, oh, sorry, we have a gift card for you this time. The peppermint patty was more popular. So offer incentives, make it an event. These people have not had any socialization to speak of with their neighbors in a year. So make this something that they want to come to. Now, I understand we're not promoting this as a social event, and we need people to move on and to move through the area quickly, but get them to take a selfie with their sticker. Get a sticker that says, I've been vaccinated. The CDC offers a template that you could just print on your own labels, on Avery labels. Give them a sticker saying, I've been vaccinated. Give them a peppermint patty. Let them take a picture and post it to your Facebook page so that they're kind of showing the world that they are brave. And because they are, damn it, this is hard stuff. And they have been really brave for a whole year, and they should be applauded for being the first in line for the biggest public health experiment in history. Make it clear that you are incredibly impressed by them, because heck, you should be. They're taking a big risk. Anyway, the one thing I will say for the paperwork part, I know everybody's up against the hour. The one thing I will say that makes the paperwork go much better, when you are putting your information into the Excel spreadsheet, there is one column for the addresses. And that column is going to kick you back if you put any unusual characters in there. So no periods, no dashes. If it's apartment 4-A, leave out the dash. Don't put a dot at the end of street or road or Ave. That should save you a lot of hair pulling. Have an extra thermometer on hand or extra batteries, because CVS comes prepared. They are incredible to work with, but you know what? Things break. Have paper clips, have bags for the trash, have sanitizer and masks for people who forget them. Have as many duplicates as you can reasonably have, so that you don't have to go all over the place to restock supplies. And a word about anxiety. The only people I have seen who have had any difficulty with this vaccine have had some anxiety issues. So let them go first, let them get it over with. And maybe have a side area where the people who maybe are having a bad reaction can sit for a longer period of time and not be kind of front and center. I mean, yes, they still have to be observed by the CVS people, but if they're having an anxiety attack, they don't want to be they don't want so many eyes on them. Definitely prepare to overstaff rather than understaff, because you can always send people off back to their offices or back home. The ASAPs have been fantastic in offering extra support that day. I really encourage you to bring them over if you can. And I will say that if there are extra vaccines, and if you are going to be using up some vaccines, think that through in advance. Have a list of who you need to prioritize and why. Think through the why, because if you are on the front page of the news for having done big donors, which I think was, one issue that they've had in terms of getting the vaccines to the right people, that's not going to look good. But if you are prioritizing the elderly aunt of one of your staff members who's immunocompromised, that seems pretty reasonable. So have a why conversation. If you're going to offer it to staff member families or whoever is nearby, just make sure you think through, okay, it's not all the highest paid people, it's the janitor's parents too, think through that. I know it's 4 o'clock. I want to offer to stay on and answer some more questions, but also be sensitive to people who need to go.
So, Marianne, I'm not getting a lot of questions, so that's great. I think we've answered most of them. What I will say is, I gave very little guidance to you in what to prepare, and you complemented exactly what Dylan and Kate said perfectly. Things we didn't think about, like glasses and t-shirts and the anxiety, and all of those things were awesome. I want to remind people that if you need help the day of with whatever it may be that CVS isn't doing, reach out now and let us know what you think that help will be. And we will try and find you volunteers from the Aging Service Access agencies or others. And those volunteers can be included in your roster and get vaccinated. So you just need to be a little bit more planful. There is a question before you jump, Dylan, about since it's the Pfizer, do you have to worry about refrigeration or anything at these sites, or you guys deal with it all?
Yeah, we have containers that handle all that. We temperature monitor.
Okay. And you guys deal with medical waste and all those fun things.
Yep, sharps containers, the whole thing. Yep.
So I think making it an event is a great idea. We have on our website those stickers that you can link to. If you have any questions after this that didn't get answered, or you want to talk to somebody, please go to seniorhousingvaccine@mass.gov. We have a bunch of people who kind of man that, and we will get back to you as soon as you can. I know we still have sort of some questions about the contact information. I want you to know Dylan and Stephen are jumping off because I have a 4 o'clock with them that we have every week and twice a week. And we will resolve this and make sure that you are hearing from them, which hopefully will be, it seems like in the next week or so, and that your clinics will be happening sometime at the starting February 28th and after, at least the first clinics. So thank you for all of you for listening. Thank you to Kate and Dylan and Marianne for being on and helping out, and everybody behind the scenes I didn't mention at MassHousing and CEDAC who made this happen. Again, good luck with everything. Don't be a stranger. And we'll see you on the other side after the first clinics. All right, take care, everybody.
Thanks, everyone.
Bye.